Gum disease and progression of gum disease. So in this video, let's look at what are the different stages of gum disease and how do they progress, and what are the signs and symptoms which we should watch out for, which will help us to be aware of the gum disease that is progressing. Typically, the gum disease starts as an early gingivitis or an inflammation of the gum. So in this gingivitis or inflammation of the gum, our gums become little red and mildly swollen. There will be some bleeding gums. The bleeding gums can usually sometimes happen unprovoked, or it can happen during brushing. Trauma during brushing can which can cause some bleeding gums. Of course, this is also having some patients will experience some bad breath will also be there, and will find it difficult to manage and maintain their gums because of the inflammation of the gums. So this is the early stage of gum disease. This early stage of gum disease typically starts because of the plaque deposits that are there. The plaque deposits that are there in the gums start the inflammation, and then the inflammation progresses further down. So this is the first stage, or the gingivitis. The next stage is the gingiva is the first level of protection around the teeth or covering around the teeth. There are deeper levels which is called periodontium, which are the deeper structures which are present under the gums. As the gingivitis progresses to the next stage, it's called periodontitis. What is periodontitis? Periodontium simply means the protective covering around the tooth structure, which includes the periodontal ligament, the alveolar bone, and the entire housing of the tooth structure is called the periodontium. Any inflammation on the housing of the tooth structure is called periodontitis. Typically, the periodontitis can be classified as three stages, early, moderate and advanced. So one stage usually progresses to if we don't intervene at any stage, without intervention, without doing treatment, one stage can progress to the next stage. The early stage gingivitis can progress to an early periodontitis, to moderate and then advanced stage. So it's very important to keep watching out for any symptoms or signs that happen, so that we can intervene at the earliest possible time. So in early periodontitis, what typically happens is our gums becomes further inflamed. There is more bleeding, it becomes red and swollen, and also the underlying tissue becomes inflamed. Because the underlying tissue is inflamed, it develops to something called the pocket formation. It means that when we put there is a very minor space between the gum and the tooth structure in a normal healthy gums. When that space becomes increasing in depth and becomes because of the gums become spongy, because the attachment to the tooth structure has become very weak, it's called a pocket formation. So now this pocket formation is a sign of a periodontitis, early periodontitis. Typically it starts at early periodontitis, and as the pocket formation increases, the swelling increases, the gums start receding also. Left unattended, an early periodontitis becomes a moderate periodontitis. What happens in moderate periodontitis? The next is the bone that supports the tooth structure also starts to resorb or also starts to weaken. Not only the gums become more inflamed, the bone also starts to resorb and weaken. So there is bone loss also happening further with the gum loss, as well as there is bone loss also happening. Now this leads to the tooth starts to become slightly mobile. Very early moderate periodontitis, the initial signs of tooth mobility is there, and the gum starts becoming even more bleeding. So the entire picture becomes even more aggravated. In terms of inflammation, the gums are more inflamed. In terms of bleeding, there is more unprovoked bleeding. In terms of bad breath, it becomes even more significant. So the entire the signs of inflammation it's more advanced during this stage. Again, if we left unattended, this gets to the advanced stage, advanced periodontitis, where it is almost the tooth becomes very mobile. There is pus discharge happening from the gum, a purulent discharge that comes out from the gum. It shows that the teeth has become extremely loose in the socket. The gum disease and the periodontal disease has become very advanced. It will eventually lead to a tooth loss. So these are the varying stages of gum disease. It's very important we identify at an early stage, so that we can protect the teeth, protect the gums, to ensure that we can have our natural teeth for many years. This is Dr. Arun. If you have any questions, please do ask in the comment section below. Until I see you in the next video, this is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja, Namalapuram since the year 2001. Please do subscribe to our channel. We're coming out with a new video every day. Thank you and bye-bye.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.